This is for positive expiratory pressure therapy, or PEP therapy. This therapy is sort of like the flutter valve, except for the fact that there is no oscillation. It's just positive pressure pushing back in the lungs, and that splints the airways open to try to get air behind the secretions to push them out. This is called the EZ Pap device. You have a mouthpiece. Some people will, or some places will deliver an aerosol treatment in line, something like that, and we're not going to be doing that, but I'm going to show you how to use it. This port right here is so if you want to run a pressure manometer, you can put a pressure manometer and actually see the pressures that you're getting. We don't have the pressure manometer, so we're not going to be doing that. Not everybody uses that. You have a piece of oxygen tubing, and that connects to the nipple here, just like that. Now, I'm going to take off the mouthpiece so that I can put it and use my filter. With this, you want to start at a 5 liters per minute. I have it hooked up to air. That's where you probably should start, or whatever the facility says. If you need to run oxygen on it, you can run it on oxygen. But air is perfectly fine. All you're trying to do is the flow going in here causes back pressure. Now, the more flow you have going through here, the more pressure, back pressure you have. So the maximum flow on this device is 15 liters per minute. So the liter flow is 5 to 15. Starting pressure or starting flow is 5, max is 15. 15 would be the highest resistance to breathe against. 5 would be the lowest resistance. You will do 3 sets of 10 breaths. They do it the same way. If they're doing a breathing treatment, they'll just... But if they're not, they take a breath, and they blow out. It's not a hard blow. I'm going to go ahead and set this to about 5. It's not a hard blow. It'd be sort of like the breath with an acapella. And you just go like that. You'll do 10 breaths, give them a break, do 10 breaths, give them a break, do 10 breaths. So I'll have a total of about 30 breaths. Again, go with what the hospital says, your clinical site. But typically, if they're only doing this, it's 3 breaths of 10. If they're doing it with a treatment, then you just do the breathing treatment. This is the PEP device, positive expiratory pressure. There are many of them out there. There's another one that looks something like this. You do not need flow. It is spring loaded, and I just disconnected the air. It's spring loaded, and you can dial in the pressure that you wish, and then the patients will just blow against it. This one is utilized with flow, and it is called the EZ Pap, which is a PEP device, flow 5 to 15. The lower the flow, the less back pressure. The higher the flow, the more the back pressure.